Welcome back. This morning, we'd like to introduce you to Joan ch6. She's a South Florida psychotherapist who persevered after a terrible tragedy, the death of your daughter back in 1998 when she took her own life. Now, we know your daughter suffered from bipolar disease, and you've written a new book that talks about the link between this mental illness and suicide. And what are perhaps some of the revelations you found with this, Joan?
Well, one of the things that I think people really need to know is that there isn't anybody that I know that doesn't know somebody who doesn't have mental illness in their families. It's pretty pervasive. And people are still stuck in the stigma of mental illness when it really needs to come out of the woodwork, to be able to be aware and be educated and have resources to know what to do if they have a family member who's suffering. Because this illness, bipolar 1, is on the spectrum. It's not just bipolar 1. There's other bipolar types, bipolar 2. My daughter suffered from bipolar 1, which is the most serious because in her case, she was psychotic. She became hallucinatory, both visual and auditory. And this made it even worse because part of the belief system that she acquired or that she had was that the devil was going to take her soul. And that caused her not to want to take the medication. She was not compliant with her doctors because in her belief system, she felt that the medication was an agent of the devil.
Now, all these years later, after your daughter took her own life in 1998, you've started to question what may have happened and how her bipolar played that factor in her taking her own life.
Well, I don't feel that she took her own life. I think that the disease was her executioner because of the delusionary demands that would come and go. I don't think Pam had a conscious will or choice to ever do anything like that. She would have never left a legacy like that to her family. She loved us. She loved her friends. She loved her patients. She was a psychotherapist too in California, PhD psychologist.
Very intelligent woman.
Very intelligent, brilliant, beautiful, inside and out. And when the disease started to take effect, she just deteriorated over a period of 10 years.
What are perhaps some things you'd like to share with families who may have a member suffering with mental illness that perhaps you didn't know with your daughter?
Well, first of all, it was 16 years ago, so we know a lot more now than we knew then. I would like to share that if there are any symptoms, any signs of depression, that is or also a mania, sort of a manic mood. Bipolar really means, it used to be called manic depressive illness. They've changed it because it's on a spectrum now. So if there are any signs of going from one mood to another where they can be completely happy and then completely manic and then completely sad, it can happen what they call rapid mood cycles. But it can also happen over a period of days, weeks, months, even longer.
And that could be a call for help.
That's a call for help for sure.
Well, the book is Why Did She Jump? Thank you so much for joining us this morning, Joan ch6.
My pleasure. Thank you for having me.
Thank you.